Do you really have a drug that can stop someone's heart in the ER? That's totally messed up. Celebrity drama in the ER, swallowing bizarre objects like razor blades, and using zoo equipment for patients? What? Today, I'm answering some of your most burning questions about the ER. We're diving into the unbelievable, head-scratching, and downright strange world of emergency medicine. Buckle up, it's gonna get interesting. All right, let's dive right in. Question number 1. What's the weirdest thing someone's ever brought with them into the ER? Not like a symptom, like an actual item. What's the craziest? People do show up with like fully packed luggages. We do find a lot of random drugs on individuals. Weapons do show up, and we do have security to hold them, at least for the individual stay. I have had people come in after like rattlesnake bites or accidental bites and bring in rattlesnakes to the emergency department. But again, I think I have a unique perspective that most things are not weird anymore. What do you do if someone refuses anesthesia? Have you ever had a patient insist they stay awake during a procedure for some reason? An example would be to have a shoulder reduction if you have a dislocated shoulder. Sometimes people don't want to be sedated, so we will give pain medication. Maybe we will do an intra-articular block, meaning like anesthesia into the shoulder joint. But you can put a shoulder back in with just pain medication and gentle movements. It just takes a little bit longer and a lot of mental willpower not to tighten up the muscle. Some people are also allergic and they don't want these type of medications. So it does happen. Do you really have a drug that can stop someone's heart in the ER? And why would you ever use that? There's a medication called adenosine that we use when somebody has a very fast abnormal rhythm. And the idea of this is to slow down your heart enough that it does a quick pause and then almost like resets, almost like you're trying to reboot a computer without using electricity. So we'll give the medication and you can see that there's a good pause, maybe 1 to 3 seconds of no heartbeat. Now people can feel this and it feels awful for a second, but then the medication does its job super fast and then your body metabolizes it so quickly that it's not really a continuous thing. How do you handle high profile or celebrity patients? Does their fame complicate things? Have I ever treated celebrities or people who are notable to the public eye? Yes. So no, their fame doesn't complicate anything. They're a patient just like everybody else.
Well, look who it is. Stan Smith, star of the local newspaper.
Sometimes there's just a privacy issue that we deal with as a hospital in general that they might need. So sometimes like when their name is on the tracking board or like the electronic tracking board, it might not show up exactly as it is. It might be like a John Doe, or it might be hash marked out for privacy. And that happens for other patients as well when it comes to their safety. So you just treat the patient as if they're a normal patient. Is it true that some hospitals only have one doc on duty for the entire hospital? What happens if, say, 2 life-threatening issues come in at the same time? How do you choose? There are small hospitals that might, at some point during the day, only have one doctor in the whole building. Some, it's just a small hospital in a regular suburban area, or it's in the middle of nowhere, rural area, and you're the only doctor. Because I've been in situations where I've had to leave the emergency department, go deliver a baby, and then go to the ICU and run a CPR, and then get back to the ER. I've been in scenarios where both people are having significant medical problems that both need my attention, but I have to go back and forth between them, and you manage that. Can you clear up some confusion between ICU and CCU? Are they just different names for the same thing, or do they handle different emergencies or critical patients, or do they even deal with emergencies? It really depends on how the hospital is set up. The ICU stands for intensive care unit, where it takes care of almost anybody who needs a wide variety of medical issues, from medical to surgical to cardiac. It depends on your hospital. But then if you have a CCU, typically it stands for either a cardiac critical unit or a coronary critical unit. And these areas are more focused on heart patients, maybe heart transplant patients, major surgeries relating to the heart, cardiac arrest, heart attack, and it's just more focused. A CCU, you're more specialized hospital anyway, so you have this extra unit. Most hospitals don't have that. What happens if someone passes out in the emergency department waiting room? Do they automatically get bumped to the top of the list? Nobody go out there just passing out in the emergency department to skip the line. But yes, if somebody does collapse or pass out in the emergency department waiting room, typically you will get them, up onto a stretcher after, you do a quick assessment, and they will go back to a bed probably immediately, because the emergency department is not a first come, first serve scenario. It is a treat the most dangerous, life-threatening life-threatening medical problem first and then backpedal from there. So yes, it does bump you to the top of the list. What happens when someone swallows something dangerous, like a coin, a key, or say razor blade? Is there a specific protocol? Is it immediate surgery or just wait it out depending on the object? It really depends on what is swallowed and the timing of what is swallowed. Meaning, if somebody swallowed something right now and then 5 minutes later came to the emergency department, it's still probably reachable in the sense that once it leaves the stomach, you're watching and waiting. Now, a coin, probably fine. Then a button battery, very dangerous because they're caustic and they can eat through the lining of, say, your esophagus or your stomach. Same thing with sharp items, depending how big it is. They also might emergently go take it out. What happens if a patient doesn't fit in a machine, say an MRI? I read online that one doctor had to use a local zoo's machinery as it was built for larger sizes. Would you ever do that in a pinch? Yes, it used to be an option in the areas that I worked, but subsequently it's not allowed. But I know there's other areas around the country and the world that can do this. There are offices of MRIs where you can do open MRIs, but again, in an emergency, typically they're not available to do it for us. So you have to either do imaging with alternative imaging. So a CT scanner is larger versus an ultrasound. But again, if you have that much tissue, it's hard to get the ultrasound beam to get a good picture of what's underneath. So it gets quite complicated and you do have to figure out, hey, how do I treat this individual with limited radiographic support? Have you ever had to treat another ER doc while on shift? Like say your coworker got sick or something. There are scenarios where somebody is vomiting or they're dehydrated and you need a quick liter of fluid, but most of the time they're checking in as a patient. So when they're a patient, they can't really be seeing patients, but there could be like a temporary time. So, quick, get treated, have another doctor cover your patients while you're getting that, and then maybe get back on shift, or you're done, you're being sent home and somebody comes in for you. So there are different scenarios. How do you handle language barriers in the ER? Say, what happens when somebody comes in and doesn't speak English or uses terms that don't make sense? Is there a translator on duty or a translator hotline? There are language translators that are remote. I work in Southern California, so there are a lot of Spanish-speaking patients, and there are also a lot of staff members that speak Spanish as a primary language that can talk to patients and translate for us while we're there with them, and we even have this for sign language as well. When would a patient have to be restrained in the ER? Is that a thing? So yes, it is a thing, and it depends. There are different types of restraints, so to speak, but why would we actually have to do that? And typically it's related to somebody being altered, not allowing staff members to do their job, or if the individual is a danger to themselves or a danger to staff members. There are protocols. The patient needs to be checked very often, and they need to be taken out of those restraints as soon as possible. Oftentimes, treating the underlying issue will then solve the problem relating to why they're combative. What makes a certain emergency department a trauma center? If there is a level 1, 2, 3, what's the difference? Is one better than the other? All emergency departments can handle a trauma, but a trauma center has trauma doctors there. The level 1 trauma center has all of the resources. So it's got everybody, and it's got everybody in-house, meaning they're there when you get there. So the trauma doctor, the anesthesiologist, the neurosurgeon, all the specialists that you would need in a trauma scenario. Then level 2 and level 3 just has to do with the doctors that are available in the hospital and what they can take care of. So sometimes a level 2 trauma center may not have pediatric trauma, so that they can handle a pediatric trauma, but then once they're stabilized, they need to be shipped to a facility that can handle it. So number 1, I wouldn't say it's the best, it just has the most amount of resources. What if you had a patient doing self-type satisfaction things in a room or 2 patients hooking up? What do you do in those instances? It does happen, and I've seen it multiple times. Typically what we'll end up doing is first ask the individuals to stop doing that, and then typically you're getting security because it's totally inappropriate. I've seen it where the individual is altered either because of a medical issue or because of a substance they took. But yeah, totally inappropriate, not the right setting, and kind of not the cleanest setting in the world because there's infections everywhere. Have you ever gotten a souvenir or memento from a particularly interesting or unusual case? I've gotten a coin from governmental departments as a thank you for the care that I gave to the individual, because I work in Southern California and there's a lot of law enforcement and government agencies that work here. Occasionally we'll see them come to the emergency department. The other thing is, at our hospital, there are times when you can get like a thank you from a patient, and then you get known as like an angel, and then you can get a pin if the patient wants you to have that. Do you ever treat somebody that is involved in an active investigation? All the time. We get patients that come in by law enforcement all the time. All branches of law enforcement potentially will bring in patients. What ends up happening is a lot of the time they need to have medical clearance before they are potentially like detained or incarcerated, and that they do have access to the appropriate care and medicine. So there are times when we will admit individuals to the hospital. They will then just have whatever law enforcement department that they're under the umbrella of stay with them 24/7, and then they are discharged and medically cleared to go back to whatever facility they are at. Have you ever had to break bad news to someone in the ER? How do you mentally prepare for those moments, and how do you handle the emotional impact? It's not really something you can really prepare for. I think after you do it many times, you get into a routine of your normal, say, script at the beginning, so that way you get the appropriate information to the patient without a lot of emotion, no judgment, nothing. Really approach it in a very logical way, because if you do not and you take it on emotionally yourself, yes, it's going to weigh on you a lot. It's going to get you upset. You may not be able to convey the appropriate information to that individual. So there are scenarios where we have to tell loved ones that the loved one passed away, or that I found cancer and this is what we have to do now. This is personal for those individuals that are a part of this situation, and my job is to give that info. Now, at the beginning, oh my goodness, it was hard. I felt like that was probably the more nerve-wracking or anxiety-provoking experience for me as a physician, but I've gotten a handle on that doing this for many years. Wow. Okay. These are awesome. These are really thought-provoking questions, plus gets me talking about my experience and what happens in the emergency department, what I do on a daily basis, and how I respond to it. So really good. Please continue bringing these questions to the forefront so we can talk about it, or me give you my experience, and that way you learn something about me. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.